Hi, Megan.
Hi, Judith. Thank you so much.
Sure.
I'm sorry. I hope you weren't busy.
Dr. Rob.
Morning.
Good morning. I love that puppy, Tasha. How stinking cute. Two? Oh my gosh. The gift that keeps on giving. You got two. I love it. I love it. That's great. That's amazing.
Thank you.
Cuties.
Okay, Tasha, you should have that email coming your way. And you don't need to worry
Thank you.
about any other part of that document, Tasha, other than
Yeah.
just the attendance
Yep.
at the top.
Yep. Thank you.
Welcome. Okay, I'm going to go on mute for a moment and then good morning, Dr. Arculeta.
How's it going?
Good. We'll start in about 4 minutes.
Okay.
Good morning, Carolyn.
Good morning, Tasha. Good morning, Megan. Good morning, Robert.
Good morning, Carolyn.
Good morning, Marina.
Morning.
Hi, good morning. Good morning.
Good morning, Judith. Yay.
This is an odd question for you, but is your name Carolyn or Caroline?
It's Carolyn. It's correct. Carolyn.
Good
I
morning,
know.
Carolyn. Sorry, I had stepped away for a moment. I'm here.
Oh,
I'm here as an attendee today, kind of. Good to see you all.
good to see you too.
I wanted to
Yeah.
ask you because I recently met someone who her spelling was the same as yours, and someone else called her Caroline, and she was very clear that she is not Caroline, she is Carolyn.
So I answer to it all.
I know you do, and I've heard you called both actually, and so I was just curious of your preference.
All right. Sorry. Both my dogs got bit by snakes this morning.
Ouch.
Oh my gosh.
So crazy. I know. And then, you know, we already are super like conservative, like really always worried about our dogs. And so we have three of them. They're like our babies. And so one was at the vet, and when Sheena got home, the other one's face was swollen too. And she's like, they both got bit. So she like had to sneak drive the other one over there right now. So
Oh
Are
dear.
they rattlesnakes or?
yeah. Like we have rattlesnakes everywhere in Pueblo West, and we have huskies, and and we do the snake be gone around our perimeter. But this was a baby one, so it's kind of like snuck through somehow. So we
Oh
gotta,
my gosh.
yeah.
Hmm.
But
You need to go, Dr. Rob?
no, they're under observation. I left. I was doing group at Methadone this morning. I ran over, and the vet's like, well, we're just gonna keep them, like we'll keep them under observation and do the anti-venom, like, but they've both had the vaccine. They've both had the rattlesnake vaccine.
Oh, good.
Oh, hey, Mike, what's up? Sorry, I just saw Mike's message.
I think Mike
So
is still in the meeting room.
yeah.
Is Mike? Mike is an attendee, right?
Mike is a panelist now. He's a new
Yeah.
member. So he
Oh,
should be on that list, Judith, that I sent you.
so am I the one letting folks in, or who is
I
letting
think
folks in?
Marina is. Oh,
Okay.
I am, but he's was not on the list, so I did not make him a panelist.
I tried to make him a panelist, but it's not working.
Oh, I see.
Oh,
Okay.
What's up,
Here we go.
Raquel?
What's up, y'all? I'm calling in from North Carolina today.
Yeah,
Yay.
I'm getting
Thank you
ready
for
to.
making that work for still, Raquel.
Are you at the SAMHSA concert or conference? Is that where you're at?
Yeah, I was invited by SAMHSA to attend a peer workforce leadership summit for a bunch of recovery
Nice.
leaders across the country, which, man, I got some ideas for us, BHA.
Nice. I'm
I'm
speaking.
excited to hear them.
Yeah, listening to other states, I feel like that's where we could grow, is going to seek what other states have done and done well and successfully, and see how we could adopt those instead of trying to always be so special in Colorado. It's
Yeah,
okay to be unique, but we're not very special.
I'm speaking next month at the World Addiction Conference on my book in Boston. So I'm like excited. I've been looking at the other speakers and I'm like, I want to ditch my session and go watch other people's sessions. But that's cool you're there for sure.
I always tell people,
Great.
all right, let's start this meeting.
It is 9:01. It looks like we have 12 members on so far. I might give it just another minute for a few more folks to join.
I'm admitting people, just so you know, Megan. And they are
Okay.
slowly coming in.
Raquel, grats with Paragon. We're partnering with them too. They're like so helpful. Congrats on the partnership.
Thank you. Thank you. Thank you. Thank you. Thank you. It's a great opportunity to combine clinical and peer recovery at a safety net level, and securing a workforce that, to be very candid, I'm concerned about is our peer workforce across the state. Very,
Yeah.
very open and candid about that.
Our workforce in general is in trouble.
I agree.
All right. It looks like we now have 14. So I think we can go ahead and get our meeting started. So welcome, everyone. Welcome to the BHAAC meeting of August 21st. There's a lot on the agenda. You all should have received all of the information in the email that I sent with the agenda and the draft of our annual report. And give me one moment. My screen's not switching over. And with that, Marina, if you don't mind sharing the meeting packet really quickly, and then I'll review that, and then I'll pass it over to Tasha for roll call. Thank you. So just a couple of reminders. We do ask that if you are not talking, that you make sure that you are on mute. And we encourage all of our council members to be on camera at all times so that we can see you. We do understand that if things feel heavy and you need to take a moment, it is okay to turn off your camera and practice self-care. So with the BHAAC packet, we have closed captioning enabled for the meeting, and hopefully you all have read through the group agreements, the council member of conduct, and all of that information is in the meeting packet found in your email. So with that, welcome you all. Thank you for being here. Thank you for your service on our council. And I will pass it over to our chair, Raquel Garcia, and our co-chair, Tasha Konkar.
Good morning, everyone. Good morning, council. Good morning, community. Good morning, BHA. Tasha, will you lead us to roll call this morning?
Absolutely. Good morning, council and members of the public. So for roll call, Danielle Ngati.
Present.
Dr. Rob Archuleta.
Here.
Preston Berry.
Present.
Raquel Garcia.
Present.
I lost my list. Anaya Hall. Carolyn Hall.
Here.
Tasha Conker's present. Judge Elizabeth Leith.
Present.
Good morning, Judge.
Good morning.
Lindsay Mausch. Maria Martinez.
Yeah.
Good morning, Maria. Maria Nagel.
Present.
Keith Parker.
Here.
Kari Puchinsky. I hope I didn't butcher that. I apologize if I did. Antonio Pito.
I'm here.
Michael Ruttenberg.
Present.
Jennifer Silva.
Here.
Catherine Washington is absent. I just got an email from her. And that concludes our roll call. Back over to you, Raquel.
Thank you so much. Thank you, Tasha. We'll do an agenda overview. We'll approve our May meeting minutes. Oh, wait, hold on. I'm on the old one. Sorry. Not this one. July meeting minutes. I don't know how I pulled up the old one. We'll approve the July meeting minutes, review and vote. We'll have a council debrief, the council debrief of the ASAM 4th edition community engagement standard operation procedure. We will BHAAC connection opportunity results. Then we'll talk about BHAAC. We'll do council business and we'll complete the survey for BHAAC hybrid community building. And 9:20, we'll do a council administrative review, part 1. And we'll review the 2024 and 2025 draft annual report, which was a true collaborative effort across everybody's busy lives. So I want to say thank you to everyone who just jumped in and chimed in to make that happen. We'll have a break, and then we'll go over council administrative review part 2 over the complete that second part of the annual draft report. Public comments at 10:25. So we need a motion to approve the July meeting minutes as they stand. Any additions? Any changes needed?
While you are all looking that over, I just want to call out that we have reached quorum for today's meeting.
Mm-hmm. Looking for a motion to approve?
I'll make a motion to approve the minutes.
Carolyn moves to approve the minutes as is. Second?
Second.
Second. Was that Maria?
Jennifer.
Oh, Jennifer. Sorry. Hollywood Squares skipped on me. Jennifer, second. All those in, and we'll go with an opposition standpoint. Although anyone opposed to the minutes as they see it? Seeing as that there is no opposition, the July minutes are approved as is and move forward. Thank you. Council. Megan, is this you on the council debrief on the ASAM?
So the ASAM, I left this on here so that we could have any follow-up questions that you all had. In reviewing the meeting from July, I was not able to join you all, but Caitlin Long came and talked with the council about providing an update. And I was reading through on the meeting minutes, just the concerns that folks had shared. It sounded like there were a lot of concerns about the burden of hospitals and ensuring that that communication was being made. And so wanted to spend a little bit of time if there were additional things folks did not get a chance to say during that meeting, or additional questions that you all would like to bring back to Caitlin and that team.
Well, Megan, I'll jump in. It sounds like they backed out on it, right? So the changes aren't happening till July 2027. So I think a lot of those worries and burdens with regard to the withdrawal management, like that all got pushed back, right? Is that what I'm hearing? So I think that kind of solves a lot of the questions and the problems we have. So now we have 2 years to like complain and be worried. No, I'm just kidding. So we have 2 years to like, reset and try to get it all done. So I think just want to make sure, in case not everybody in this meeting knew that it got pushed back. So I think that a lot of our anxiety and worry is put on hold, and hopefully now we have time to create a plan that's sustainable for everybody.
Thanks, Doctor. Appreciate the feedback. I did not know. If they pushed it back, that's a good thing.
Right? Am I wrong in saying that, or does anybody else know? Jennifer says I'm right. Yeah.
You're right. You're right. You're right. And then Megan, I also saw where they're doing more stakeholder feedback in different regions on the ASAM level of care change. So I think that's also really a good thing. I noticed one is coming up in Alamosa soon.
That is great. And all of that, all of those engagement sessions for that feedback should be on our events calendar, on the BHA calendar. If you just put in events under search, that you should be able to find all of those throughout the state as well.
Thanks for that, Megan. I'm sitting in the supervision meeting, so I haven't been sitting in the ASAM meeting. It's hard to get to all the stakeholder meetings. So that's good that they're in one spot. So I think we're done with that. Any other comments on that ASAM level 4? Thanks for your input, Jennifer. And same with Dr. Archuleta. All right, seeing there's no more comments on that. We'll talk about the BHAAC connection opportunity results. So I will be candid, have not sent out an email to everybody. We had been trying to figure out if I have to do that privately, if I can, or if I have to go through the BHA for that. Found out that I can do that myself. So Tasha and I will be getting together to do a creative connection in October for us to connect in person. We are going to do in person, more than likely in my offices in Castle Rock. It tends to be kind of a medium point. Dr. Archuleta can come from Pueblo, but we will do it hybrid, we've decided. So we will be really creative because we are very adamant about trying to include even Mr. Preston Berry down there in our southern region to make sure that he can be involved as well. So we will do a really creative job. I'm working with somebody to come up with something kind of creative for us just to connect personally so that we know each other. I think that was something that was a challenge for us in our previous council. And so I want to make sure that Tasha and I want to make sure that we have that connection. So that is on the horizon. In council business. Oh yeah, that's what we're talking about is the BHAAC community, the hybrid community building. So I'll let you guys know about that. Moving forward to council administrator review, we can move on forward, Megan, all the way and start reviewing our annual report. Are we ready for that?
I think so. And so Marina is going to share the report, and then just for you all to have transparency, I will be in the report making any revisions and edits that you all are requesting at this time. I just want to thank you one more time to the folks that spent, I think I counted, it was over 10 hours of time collectively spending time writing the report. Our report writing subcommittee was Tasha Konkar, Raquel Garcia, Catherine Washington, and Caroline Hall. You all worked really, really hard, put in so much effort. And then I also want to recognize we did it a little bit different this year so that all of you had the opportunity to contribute through filling out the feedback form. And we did get feedback on that form that was really helpful. You'll see all of that throughout as well. Once we get to the end of the report, that is where there's some additional recommendations, and that part has not yet been completed. And so I do want to make sure we have time to get to that part and make sure that you all have time to put in your input into it as well. But just thank you so much, BHAAC. You all are amazing. And in the process of writing this report, it was really wonderful to reflect all of the work the council has done and the growth between BHA and the council over the last year. So with that, I will hand it back to you, Raquel.
Yeah, it definitely, I feel like, shows this honest reflection of restoration. We've been a council of no BS, which I think I'm really proud of, but also one that allows for restoration. And I think that that's what this report is reflecting, is the restoration of trust between BHA and council, and just our really hard work behind the scenes to build relationship. All right, let's move forward.
So just to let you all know, on so this first page, I will go back and modify the page numbers just in case they change as we make edits.
And so first is the executive summary. I won't read, I'm going to read probably most of this, but everything we won't read word for word. But I think it's important that you understand this is a report that is written into statute. We must, as a council, submit this report every single year. And for those of you who are new on council, maybe go back and read the old reports that we have given for the last 2 years so that you can see the progression and how those have, I think, been really honestly reflective of our experiences. So the Behavioral Health Administration Advisory Council was created for the purpose of making recommendations to the BHA Commissioner and the State Board of Human Services to improve the behavioral health system for children, youth, and adults throughout Colorado. Per Statute 27-50-71 CRS. The revised collaborative framework between the Behavioral Health Administration and the Council represents a significant shift towards a more supportive and engaged environment that emphasizes the BHA's commitment to improving behavioral health systems across Colorado. This renewed partnership has aligned our shared goals and challenges and has increased our capacity to advise the BHA through open communication and cross-collaboration. To create the fiscal year 25 BHAAC report, the council created a report subcommittee that created a recommendation form to collectively gather information from all council members to be consolidated into the annual report. Additionally, this subcommittee met 8 times to review the information and formulate recommendations based on the identified behavioral health needs of our communities throughout Colorado. Consisting of 4 council members and 1 BHA staff representative, the report subcommittee collaborated with the council as a whole to organize our recommendations about the identification, underserved populations, the statewide grievance system, the performance monitoring system, and the behavioral health safety net system, as we are called to do by statute. In summary, the council recommendations continued collaboration with BHA leadership and contracted community partners to better understand the aforementioned systems and how they work together to create the larger behavioral health system. Additional recommendations and specifications of the BHAAC can be found below. So that was it. That was the executive summary of what we felt we did this last year. Any reflections, responses, any additions or changes that need to be made?
Raquel, we had given we had given feedback about the grievance, and calling it feedback and looking like we're soliciting grievances. I mean, even in the last meeting, it looks like that was kind of just not brought up or addressed or even discussed again. I know it's like, I know we want to say that we have a system for complaints, but again, like I just want to say it again, like, you know, the council was pretty adamant about the verbiage and, using this idea of a grievance because it is something that gets thrown around and like I said before, it could be deflating. I don't understand why it's not feedback, and that way we get positive and negative feedback. So I just want to throw that back out there because it seems like that was kind of skipped over the last couple times.
And we will make sure that that is when we get to that grievance policy report, that we will make sure that that's there. Because yeah, you know me, I'm not going to let that. We won't let that slide.
Yeah.
Yeah, absolutely.
Raquel, this is Marina. Let me know how fast or slow you want me to move down the report, as I'm only guessing. So just let me know.
Yeah, you're good.
Scrolling.
I pulled it up too, so I could see what's coming.
Okay,
up next.
good. Okay, good.
And Raquel, I might suggest this page, the introduction and the definitions. I don't know that we're going to have time to go through and read them all because I do want to make sure. I think it's more important to go through and read the accomplishments, and then, like Dr. Rob just brought up, being able to make sure that we're adding in any additional recommendations. Dr. Rob, I can't remember if that was on there or not, if we added that yesterday or if that was just in my head from going over the meeting minutes yesterday. So we'll definitely get to that later on in the report.
Yeah, no, like I said at the beginning, we're not going to read it all. I wanted to read the beginning of the executive summary so you make sure that that's what's reflective, so you guys understand what's pulling through that report and what we're trying to show through that. Tasha, what you got?
I just want to say the mission and the vision statement in this report came directly verbatim from our bylaws. So just to keep complete transparency there. So it's verbatim from our bylaws.
All right. So we're going to go through page 2. Everybody can read the definitions on their own. What page are we going to? Let's see, creation of annual
Page 5.
calendar. 5. Okay. So the accomplishments. So we list the accomplishments that we feel the things that we accomplished this year. One of the things that we speak about in the report is the election of council officers. I will share that I know we have some work to do in this area, but we also have come such a long way from the first time that even we were set up to be council members, being able to have applications completed and we have a packet now that kind of informs folks. So we've come a long way from that. And so we successfully elected new BHAAC council members who brought some strong collaborative leadership, and that we're hoping to offer open communication and then strengthening partnerships. And I know council, you are relatively new, but that's what we hope to have here. Inclusion of council debriefing in minutes. So the council has advanced inclusion by adding a standing agenda item for a debrief of the previous month's presentation. So we change those agendas, right? Like it's not enough for us, you guys, the BHA to present us something and we don't get to go back. That's why we went back to visit ASAM at the beginning of this meeting, is so that we are going back and getting that feedback back and forth. So, for example, in February, the council revisited January's community engagement review, allowing members to explore additional questions, provide further input, and deepen collective understanding of the topic. Again, Dr. Rob also about keep speaking up about the grievance, proposed grievance policy they've given us that we are pushing against. This approach ensures ongoing dialogue. It reinforces transparency and strengthens the council's collaborative decision-making. So that's where we feel like we have grown. The first 2 years, we were just presented to and not given opportunity for feedback. And this year we have changed that. Any feedback on the election of council officers or the inclusion of council debriefs in the meeting? All right. The other thing we think we've accomplished this year is the creation of an annual calendar to guide the meetings. So we worked with Caitlin to create a calendar. We will be building that again this year. In January, the council implemented an annual calendar to guide the BHAC meetings, outlining the topics members wanted to hear from, right? That's why we were listening to that grievance policy, in addition to those required by statute. So there's some that we have to be told about, and then there's things that we want more answers and questions on. Like one of them is, wanting to hear from Medicaid. Was one. And I feel like this proactive approach ensures discussions are relevant, member driven, that we're not just presented on the things that they want to tell us, but we have input on the things that we want to hear about. So it goes a two-way street there. Next is the creation and implementation of the BHAC bylaws. BHAC finalized bylaws for the council and voted them in. The bylaws the bylaws are shared with all members prior to each meeting, and with the support of BHA leadership, the chairs have enforced the bylaws to ensure smooth and productive meetings. So that's Tasha and I's responsibility. Anything on the annual calendar in the BHAC bylaws? All right, seeing as there's none, we'll move forward. The BASO and RFP scoring committee, we had members present for that on the BHAC representation, which is wonderful. The BASO scoring committee included council members. Council member representation as a voting member to score the RFP submissions and inform the selection of each BASO region. Additionally, this allowed BHAC review of BASO contracts prior to launch. So good that we got to be in on the entities that will be managing our behavioral health across the state. The other one is providing feedback for the BASO branding project. BHAC played a key role in providing feedback to the BASO branding project. We were all sent out an opportunity to do so. And we also launched the Colorado Lifts Network. A lot of us, especially those of us on council, some of us were present for that, and it was really nice this year. I think one of the things I spoke was that it was nice to be present in person with council this year. Like to be, not with council, but with the BHA. So it has been nice to be more physically present in the community. In Alamosa, whether we're in Denver. I could advise BHA on the BASO.
Am I the only one that is not hearing Raquel, or is that everyone?
Raquel's coming in and out.
Yeah.
Okay.
Can you hear me if you can't see me?
Yes.
Okay, we'll just do video for a second.
That's better.
Oh.
The next thing we accomplished was better. BHAC advised BHA. Still not working.
Keep going. Maybe it'll come back. It did disappear just for a second.
Back? I'm gonna flip to a hotspot, see if that changes. All right, can you hear me now?
Yes.
Thanks, Marina. Like a Verizon. Just switch to my hotspot view for changes. Okay, that might be better. Can you hear me now?
That sounds better, Raquel.
Yeah.
Okay.
Yes.
Yep. I switched. Yep. So BHAC advised the BHA on BASO regional councils and the recruitment process. So the BHA and the BASO created regional councils, and the BHAC advised the Behavioral Health Administration on the formation of the BASO regional councils and the recruitment process, offering recommendations to ensure diverse representation, transparency, and community engagement. The other thing we accomplished was we increased in-person presence, like I said, at BHA events, where we were seen more in person with community, even asked at times to speak on behalf of council or of a community. which was really nice to be in community with people, not just on Zoom. And we provided feedback to the community, even with being present. It was nice to be in community and educating folks on what the BHAAC Council was and what we do. Any feedback, any changes, any edits that need to be made to the BOSSOs, any of our advisements, and the increased in-person presence from Council. Tasha?
I'm just curious about the BOSSO regional subcommittees. That's my only concern right there, because from what I can remember, we didn't really advise or do anything when it came to the regional subcommittees.
I think when you all were writing that, that was the presentation that I gave to you all, and I believe Caitlin was part of that one too. It was way back when, and it was on the BASA regional councils on the recruitment process specifically.
Do you recall what the recommendations were, Megan?
That is where actually you all recommended that a BHAAC member be on the review committee. And so that was added to it. I can't remember which one of you added this to the report. I thought it was you, Tasha, but since you're the one with the question, maybe it wasn't you.
I just what maybe there should be, maybe I'm looking for some clarification on where we are in that process right now. Where does that stand as of now with those regional subcommittees and how they're coming along?
The regional councils are still in the recruitment process. And so the applications for that close the end of this month. And then those will be reviewed in the first 2 weeks of September.
And who is going to be reviewing those applications?
So those are reviewed by the review selection committees that have a BHAAC member, a BHA representative, BASA representative, and Marina is actually helping to support that. Tasha, I can have Joy Hart provide us with an update on that. I want to try to keep us on task on the report, but absolutely can have Joy Hart provide an email update that I can send out to the council on where that process is currently at, as she's the lead for that. Yeah, absolutely.
I appreciate it. Just we all know transparency and genuine accountability. So
right. Thank you, Tasha.
The application for the regionals, they have been published. They've sent emails out, Maria. And I know that they're out on social media. I've seen them on LinkedIn. But we can also send an email to council. Marina will send us another one and just make sure that thanks Marina, I saw you nodding, to council to make sure that you have an application if you know anybody who's interested in joining those.
I'm actually going to drop that in the chat, Raquel, if that's okay.
Perfect.
The link to the website that has all the information and also the application. And I was just going to chat Joy to see if she can get us an update or share some information, but I'm going to drop everything in the chat here right now. So just give me a second once I'm not sharing the screen.
Yeah. That's okay. Thank you so much, Marina. We'll get that in the chat for you, Maria. Oh, you're welcome. Absolutely. Absolutely. All right. Anything on our accomplishments? Did we miss anything, council, on accomplishments? For those who've been here? Anything we need to change or edit on accomplishments, council? All right. Well. Shipping agenda 9:34. We're ahead part one. Are we through part one? You wanted to get through accomplishments, maybe? You want me to keep going? I can keep going.
I think we should keep on going.
So, all right.
Yeah, let's keep on
I
going.
got you. All right. We are going through, I'm trying to time mine here. Okay, statutory. We're on the same page. Yeah. Okay. Statutory recommendations. These are the questions that were kind of in those. This is where we came up with the questions for the survey, because these are the ones that we have to answer in statute. Statutory recommendations: identification of underserved populations. The engagement team and regional engagement specialists shared updates about their framework for working with underserved communities. These populations include people at risk of homelessness, children and families facing out of home placement, justice involved individuals, people of color, American Indians, Alaska Natives, veterans, pregnant individuals, LGBTQ plus communities, and individuals with disabilities. Council members provided feedback that was included in the engagement framework and regional plans, and the regional engagement specialist program provided highly effective building strong local partnerships, hosting sessions that gathered hundreds of voices and creating a reliable feedback loop between communities and the council. However, the program was dissolved, leaving a significant gap in inconsistent regional input. The council is requesting the creation of a feedback process with the BHA that includes presentations and updates from the BHA commissioner, BHA deputy commissioners, and chief of strategy officer present during regularly scheduled council meetings, as well as a biannual one-page report from the executive leadership team that includes follow-up and clarification of topics discussed with executive leadership in council meetings. So we did talk about, we loved the regional engagement teams because they also gave us somebody that we could tie community to, but unfortunately that program was dissolved. So we wanted to speak about that. We have some recommendations about the identification of underserved populations. You scroll down, Lena. Get down a little bit. Let's just go down, keep going. Yeah, right there. The council recommendations about the identification of underserved populations, that the council recognizes the success and the stability that was achieved by the regional engagement team, and unfortunately that program was dissolved at the end of the fiscal year 25. And we talk about how that left a significant gap, right, in infrastructure for community engagement and representation. So we talk about how the absence of these roles has left a critical gap. Number two, if funding does not allow the BHA to prioritize reestablishing an engagement team, use volunteer peer liaisons and council members to help gather feedback regionally. Because the thing is that we're still not gathering that feedback regionally unless people make it to the meetings that the BHA sets up. The council recommends that the BHA implement a structure to ensure engagement and collaboration with all underserved communities, and that they leverage technology, virtual town halls, and online surveys to keep participation broad and low cost. And then we ensure all materials are in plain language and ADA accessible formats so community members can easily understand and contribute.
I think the town hall idea is great. I think anytime that we can hear any feedback from, the people directly in those communities, gives them that feel of being at the table, when their concerns in their communities.
Yeah, especially like even that virtual town hall idea, Preston.
Yeah, I like that. Mm-hmm.
Because transportation's a barrier. Thanks so much, Preston. Dr. Rob?
Yeah, did we also identify the offender or justice involved population as the underserved population? I know I put that on my feedback form because it does seem like there is JBBS, but I think it's still a very underserved population because there's not a lot of, there's just a lot of barriers to treating that population, whether it's peers' backgrounds, not getting them into the services, or whether it's having transportation to those services or getting methadone into the jails or detoxes into the jails. I just think that definitely is an underserved population.
Absolutely. I kind of am pushing away from the word justice because I'm not so much about that anymore. The legal involvement. Let's use that. I think those that are involved in the legal system. Megan will make that edit. So good. Thanks, Robert. Appreciate
Okay.
that, Dr. Rob. Anybody else? Maria,
I'm
please.
actually, I see it. It is in there. Um, if you go more higher to the top, Marina. Sorry.
Justice
No, not
involved.
there. Yeah, it's if you go to when you're going too fast. Okay, go down a little bit more, sorry.
Is it in definitions, Megan?
No,
Oh.
it's in
It's in statutory recommendations. It says it said justice. I just changed it to legal involvement. Legal involved.
Okay. Okay. Cool.
Yep, here, right here. Sorry about that. Legally, here it is. Yeah.
Okay, I see you just edited it.
Yeah, I really struggle with justice. I'm just really pushing back on that word because I don't feel like it's a justice system. So people are changing, even where I'm at in SAMS, they're changing to like legally involved.
Okay.
Yeah, that's right. I'll mess with it.
So
okay,
that definition came out of our statute. I have no issue with I think Raquel, I'm not saying we can't change it. We can, I think absolutely the council can decide if you want it to say legal. I have no issue with that. Because as we talk about what that definition is, we don't have to have it be verbatim what's in statute. If we want to have it say legally, or it could say I don't know, maybe I don't want to put you on the spot, Judge Leith, but I would love to hear your perspective on this.
Thank you. I honestly, the verbiage matters, right? And I agree with that. I just want to make sure, though, that however we phrase it, it captures the fact that there's a large community of people who are not getting served, who are involved with the criminal justice system, right? And we get better service for people through the civil systems, but what we're trying to do is create a civil system that can accommodate these folks. And my concern is that if we don't identify these people as actually being involved in the justice system or the criminal justice system or something along those lines, that will get lost.
How about legal system involved?
My issue with that, honestly, is that the legal system encompasses both the civil and the criminal systems. So, like if someone's on a cert, they're in the civil system, they're in the legal system, right? And it doesn't really, from my perspective, identify those individuals who are in the criminal piece of the system.
So I was going to jump in with the judge. Like, I'm with you, Raquel. Like, I like changing the verbiage. I think that's two fights we're fighting right there, is changing that verbiage. But if the vernacular of criminal justice, if that's the vernacular of our field and that's what's going to get people noticed, I mean, I think we got to take that on the chin and stick with that so that it doesn't go over people's heads or under their, unaware. But I do think that that's another fight that we need to fight as well.
Right, Raquel, sorry if I'm speaking out of turn in my first meeting, so I'm going to apologize in advance. Raquel, is your comment more about the labeling of people and what that feels like?
I struggle. We're calling it a justice system because it's not a system of justice, just to be very candid. That's the one that's the pushback that I have. But other than that, I'll go with the majority on it. But
Raquel, I totally understand. I was kind of going along in the same line of thinking as the judge, is that the criminal justice system is what it's referred to, not only in Colorado but across the nation. So if we're speaking to the public, I think that they need to understand what segment of the population we're talking about. I agree that we have to do whatever we can to not demoralize humans that find themselves in that system, because they are not bad people. They are not offenders. They are not convicts. They're not any of those terms which we've moved away from. But I do think, as we're speaking to the state and the citizens of the state, that we need to use language that they understand and know exactly what we're targeting.
And I love that. I think even adding that criminal piece adds a lot to it too. I think that, like Judge Lee said, it encompasses it. Maria, and then Tasha.
I just want to say that the underserved population, I think that's being missed, is those that are truly without any kind of food access, internet, ability for transportation. So a focus group for someone to travel to get there is not, how you say, acceptable. I think the senior population is totally not inclusive into a lot of what's happening. Um, I just feel like focus groups that are held like at a library or something, it needs to go deeper into where there's more desert areas because I just don't think people don't even know what behavioral health administration is. They don't even know that that's an access for anything. So whatever language or whatever, I think the presence of this community needs to be accessible for them to see, maybe go out further.
So in excess, you're saying some of the underserved populations, the senior population, I'm hearing, Maria. And then I heard accessibility.
Yeah, because you have seniors that are on parole or probation, that have mental health issues, that have other issues, and they're not addressed. They can't get access to a lot of stuff that other people get. You know, I'm one of them individuals as a senior, and as I get older, I find it more difficult to receive access to some care.
Well, thanks for that feedback. Thank you, thank you, thank you. And we're at break. 5 minutes, is that what we're taking, Megan?
Yes.
Coming back? Tasha, did you have something before we close out, or are you going to hold it?
I can hold it. I was just going to make a comment about the justice system, following up with that. So if we want to, I can wait till break to do that, or yeah, so we stay on task.
All right, 5 minutes, y'all.
Okay, that brings us back at 9:52.
Yeah.
It's been up, Raquel. I feel like I haven't seen you in forever.
Oh my goodness. Working.
Yeah.
Yeah. It has been a long time. It's been a doozy of a year, let's be real.
Yeah, for sure.
Hey,
Mike, it's good
Raquel.
to see you too. Sorry.
Hey, what's up, Preston?
Hey, nothing. Hey, I have a conversation I want to have with you when we get a chance, maybe after this meeting. I've got some
Yeah.
big changes here with my position here at Behavioral Health.
Yeah.
Yeah, so I was actually me and my wife started a business in town here, which doesn't align with my current role and my position here. So there's going to be some big changes happening. I just don't kind of want to touch base with you and see how that affects my council seat.
Yeah. You just reach out to me. We'll have a meeting and we'll take a look at that. Definitely, Preston.
Awesome, cool, thanks.
Remember, yeah. Welcome back from break, council. Welcome back. All right, Tosh, you want to lead us off? I know you had to share.
Yeah. When it comes to the criminal justice system, and this is from my own personal lived experience and supports what Judge Leith was saying, is a lot of the times like my mental health is what got me involved in the criminal justice system. My mental health was not addressed. I was labeled and charged and had to go through all of that, which just compounded my mental health issues on top of that. So the criminal justice system is not a place for mental health. Like, it's not, because those people are not
Equipped for that.
criminals. You know what I'm saying? Like, it's a struggle, and especially when you're dealing with invisible disabilities, and the implicit biases and stuff like that are on there. So I just want to support what Judge Lee said.
Thank you for that, actually. And Maria, do you have a new question, or is this the same hand up? I just don't have the ability to put it down. Just checking. And council, just so you are aware, Marina went ahead and put the website for all the BASO information and the link for the application in the chat. So you should be able to pull that up and distribute. All right. All right, Marina, can we pull that up below statutory recommendations? We are at grievance system. So here, Dr. Rob will make sure that we didn't have anything else. We made it all the way through the recommendations for, hold on, I'm sorry, I lost anything. Oh, the identification of underserved populations is where we concluded. Any feedback, anything else on the identification or any other recommendations on underserved populations? The identification of Tasha?
I would just like to make a recommendation, and I don't know if this, I'm just going to say how it is. With my experience up here in Larimer County and being involved with our county and stuff like that, and what they're doing with mental health in the criminal justice system, and all of that together, I really think that the state should look at what Larimer County is doing and seeing if we could implement that across the state, because it's a real success.
Thanks for that, Tasha. All right, we'll move forward. If there's anything that comes up, this is just a draft. And so you can fill out the application, you can send an email. If there's anything that comes up later, if you send that to myself, Megan, and myself, Tasha, and Megan, we'll make sure that gets pulled through. And then we'll have a final before we go and submit to the state. Whitney?
Okay, I'm sorry. I'm going back to the survey that we filled out. Um, I forgot to place on there because I had mentioned what about Braille? And so I haven't heard any updates. So are we trying to get someone to do Braille? Because there are a lot of people who are left out because of their sight. And so I had mentioned that I forgot quite a while ago. So are we working on that?
Working in for Braille for what piece? For this report, or is the recommendation to identify the underserved population, or making sure that things are in Braille, or all of the above?
For everything. For everything. Because like when you're putting information out there, and if you're dealing with the underserved, people with sight problems are definitely one that's being underserved. And part of that stem for me is because my father, as he aged, he has a medical condition and he lost his eyesight. And so he loved to read the newspaper, just read up on anything that was going on. And so I think we should make everything in Braille as well so that people can know what's going on with the organization and how to like address any kind of issues that they would like to talk about as well.
Appreciate that. I know that the conversation had come up about Braille, also that younger populations too, not taking out the older populations, don't use that language as much anymore. And it's not taught. We had somebody who was in here private that had kind of suggested that as well. So thinking of Braille and then other alternative technologies that could also make sure that they are informed too. So not to just limit it, I think for some of them use like readers, screen readers and things like that. So I agree. So something that is for the vision.
Okay.
Okay.
Thank you.
Like audio. Whoops.
Yeah, Carolyn, keep going. Come on, Carolyn. Did you say audio, Carolyn?
Yeah.
Correct. That's what it is.
Yeah.
If you don't have to. Thank you.
You're welcome, Whitney. Thanks for speaking up, Keith.
Yeah, I don't know if I missed it or it might have got by me, but how do we make the grievance system more accessible for the underserved community?
Well, we're about to get to grievance system here in a second. So right now we're on I'm going back to make sure that we've cleared anything on the identification of underserved populations, and then hold that thought, Keith, because we're moving right into that grievance policy.
Okay.
So anything else on the identification of underserved populations? If not, again, feedback, we'll move forward. Going to the statewide grievance policy or the grievance system. Based on the
Oh, sorry, I didn't know if we had that on there. Is that people with learning disabilities also? Would that be I'm not sure if I remember seeing that in there.
No, thanks for speaking.
Are you asking if people with learning disabilities are included in the definition of underserved populations?
Yeah, or if that would be something.
It says people with disabilities.
Okay, yeah, I didn't recall that, so that's cool. All right.
No, it's a good question.
No,
Thank you for clarifying and ensuring, Preston.
No, it's good to have the dialogue. I'm enjoying it. Okay, so moving on to the the grievance system. Based on the information provided to the council understands that the system-wide grievance system is a critical component to the statewide behavioral health system. We know that it's a structured mechanism for addressing and resolving complaints, which is the word that we didn't love within the Colorado's behavioral health system. Increases accountability. The system-wide grievance system helps to identify systemic issues and areas of improvement and contributes to the reformation efforts in an inclusive, accessible, and equitable behavioral health system for all Coloradans. The council was informed about the system-wide grievance system through presentations during regularly scheduled council meetings, newsletters, and websites, and Q&A sessions. Council has been informed about the system and was appreciative of the frequent updates from the BHAAC grievance team about the system, its current state, and the future goals for improvement. The council now views the grievance system as a cornerstone of accountability. This is where we're probably going to have some edits in here. Let's see. Simplify the process needed to navigate finding the complaint form. So Keith, this is kind of what we're talking about. So council recommendations about the system-wide grievance system are as follows. That we simplify the process needed to navigate finding the complaint form. So that part, Keith, is what you were talking about, making it accessible. This includes providing ADA accessible accommodations. This is what we were talking about. Whitney, I think, spoke up about to ensure that the system is accessible and comprehensible for all persons in Colorado. We recommend that the BHA have multiple methods for a grievance submission through online forms, phone, mail, and in-person submissions, right? Satisfying what you were talking about, Whitney. Additionally, we recommend that the BHA develop a supportive hotline to facilitate any ADA recommendation requests and to produce materials that are viable in large print, multiple language, and are accessible to screen readers. So something to think about. We also recommend we offer support services to assist individuals navigating the system-wide grievance system. This would include improving access to individuals that do not have access to a computer or internet. This would kind of go along with what Maria was speaking of. We recommend partnering with legal aid organizations and local community advocates to help educate members of the public about their rights and options regarding grievances and services. We recommend the BHA to provide quarterly updates at council meetings that show how questions and recommendations are being addressed in regards to the grievance system. A feedback tracker with status updates, pending, in progress, and completed. We suggest timekeeping measures, acknowledgement within 5 business days, update within 10 to 15, so like some expectations. We recommend that the BHA provides the council with a step-by-step walkthrough of the grievance process to include scenario-based examples and to illustrate how different complaints are resolved and concluded with a Q&A. Train peer support navigators to guide individuals through filing and following up on grievances with individual suggestions. We suggest provide a plain language handbook with short visual and ADA compliance and publish quarterly by the number snapshots on the BHA website of grievances, filed, resolution times, and themes. So, and I was not present for this one, but I can see that we skipped all of that suggestion that Dr. Rob was speaking of, which is to not make it punitive and also make it positive in nature. That was a big thing we talked about for like 2 days, 2 sessions of making sure that the language around that changed. And that it only highlighted, it seemed to be very negative and punitive and not positive in nature. And I think the word too is complain. You know, I like to use the word correction over complaint, but I think that's another thing that Dr. Roberts spoke about, that it just seems like a place to complain. And that it doesn't seem to be very solution focused. I remember that being some of it as well, that it didn't seem very solution driven. It seemed more of a place to like the complaint department. So I do remember those conversations, Rob. All right. I'll go around. Keith, I know that you I wanted to give you the opportunity to speak first, and then we'll go to Tasha and then Carolyn.
Right. So you said something very important there. I didn't even know these people existed. Peer support navigators. Is that an actual thing now, or is that something that we're going to get?
No, it's something we're suggesting. So these are a list of suggestions, and what we're saying, this might help them with their grievance policy. So these are recommendations that we have.
Yeah, I would strongly suggest that, because I'm in need of those services. I put myself in that position, and there ain't no, direction of how to navigate the system, because if you have a hard time, you're gonna pretty much quit. You're gonna pretty much give up. So if you don't have somebody that's trained to deal with people with mental issues going through that process, they will even lose patience or whatever dealing with that whole process themselves. So that is a must, that there be some kind of peer support, because if you go to Well Power or whatever, they're going to navigate you through their system, because being a client of a mental health organization, that's even tricky business. So having peer support navigators is a must. That is step one in the grievance system, because I didn't even know they had a year ago. I didn't even know they had a grievance system to even you know, tell if you wasn't getting the a proper mental health treatment in the system. That's why, like I say, a lot of people just give up because they don't, you know, they don't see no clear cut course, you know, for their issue. So that is a must, that you have
That's great.
peer support navigators.
Yep,
It's a
this
must.
is, we will, so we're going to put the suggestion that they will add a peer support navigator to help someone navigate the grievance, call it the grievance system. So just, we do, I mean, we have peers across the state, but we're speaking specifically just about the grievance system. So yeah, I agree. I think it would be helpful if someone's struggling that they would have peer support to help them take care of that. And also, I think also with that is educating providers about that. But I think that's where we're going to have to, if you want to provide, if you want providers to actually help and be encouraging of this system. And, you know, I don't mind navigating somebody, but I think that this is where Dr. Archuleta has talked about, like, we have to, you don't want to do something that repels your providers. You know, it's not that we're accountable. I'm willing to be accountable. If we're not doing something right, please talk about heartbeat. You know, Dr. Rob wants the same thing, but you can't alienate your providers to this being a giant place where people complain, or your providers don't want to work alongside the BHA, right? We're also supposed to be doing a community-based work. We have to be really careful. And some other places where it doesn't feel punitive all the time. Your providers don't want to go to places where they're going to constantly be chastised, not accountable, right? That's different. So anyway, I'll keep going. Tasha, then Carolyn, and Dr. Rob.
Raquel, can I jump in real quick? I just want to flag that it's 10:08 and we are wrapping up at 10:30, and we still have 3 additional sections. So just as you all are sharing feedback, I don't want us to go into a rabbit hole of discussion during this. This is really, if you have something you want to add to this report or remove from this report, this is where we need to be able to identify those things and then save the discussion. For the next year, we will be discussing all of these things in depth. So I just don't want us to get off track. So just wanted to throw that out there.
Well, yeah. And even then, so if you've got suggestions, if you put them in writing to us, it's easier too, because then we'll make sure that they go in as a suggestion to council. Carolyn, and then Robert.
I've been thinking about languages too. And I know that grievances is kind of hard. People are seeking praise as well. So my thoughts is utilizing the words occurrence and feedback, because then the occurrence can be a positive thing. It could be a negative thing, but sometimes we can't just go into feedback, because how are we going to understand what has happened to an individual and the trauma they've experienced if they're just giving us feedback on something and we're missing half the picture.
Thank you so much for that, Carolyn. Dr. Rob?
Yeah, I'll be super fast. I already stated my point on all of this. So the one thing that I do have an issue with is we stated our point and talked about everything that we wanted. The very next meeting, the flyer was there. There wasn't one change to the flyer. I don't want the same thing to happen with this report.
We'll make sure that you get your eyes on it, definitely, Dr. Rob, before we submit.
Cool. Thank you.
Welcome. All right, so we'll go through them quickly. And again, right, this is just a draft. I'll keep us on time. I'll pay attention to time again. And then what we'll need to do is any suggestions, just email us. Let us know what you guys think. And you guys have copies of this, so go through it. All right, so we will add, I'm Dr. Rob and I will draft some stuff because I do want to put that in there to the grievance policy. Performance monitoring system. Based on the information provided to the council understands the performance monitoring system to be a services assessment tool that aims to increase the transparency of accountability of behavioral health services throughout the state of Colorado. Our suggestions are adding qualitative data, service, focus groups, interviews to capture community experiences. We are more than just numbers. So data, I think, is important. That should also have a qualitative point. Tracking demographic data gaps, veterans, people with disabilities. We'll do that. Criminal justice involved. We'll change that language. I like that. Involved populations. We suggest that making the Performance Hub mobile and screen reader friendly. Again, thinking of our visually impaired folks with a step-by-step user guide. Providing quarterly one-page summaries for easy reference. The council is recommending increasing the qualitative data collection to not only identify the services being offered, but the quality and access of services provided. as well as the quality of life of persons accessing services during and after care. We're also suggesting providing ADA accessible accommodations for the peer performance monitoring system to ensure that the performance hub and its data is accessible, digestible, and linguistically comprehensible for all persons in Colorado. We recommend that the BHA increase technology access and utilization by reconstructing the performance hub platform so that it is accessible and interactive for both mobile and desktop users. Furthermore, we recommend creating an interactive user guide that demonstrates how to navigate the performance hub. We're recommending that we increase transparency and public participation by informing the communities of the quarterly performance hub updates during regularly scheduled council meetings and demonstrating how council and public recommendations have been incorporated into the performance monitoring system. We're suggesting to partner with universities and interns or volunteers to help gather qualitative data at low or no cost. And we suggest using short community surveys online and in public events. We suggest prioritizing low-tech accessibility, printed guides, call-in options for people without internet access. And lastly, keeping the performance hub simple and user-friendly to avoid costly overhauls. Next section, behavioral health safety net system. The council has increased understanding as to what constitutes the behavioral health safety net system. The council understands that some aspects of the behavioral health safety net system, such as relationships with behavioral health administration service organizations, the BHAACs, but lacks a clear understanding as to how these organizations work with BHA and within the communities to make up the larger system. So we just want a little bit more clarity on how they work together. I'll skip down. So our recommendations, everyone else can read it. We recommend that the increased education for council members and the public about how the safety net functions. I've watched this, just to be honest, I'm watching the bosses starting to talk about who they are and what they do for the state. So that's been kind of cool to see. Have you seen that, Dr. Rob? I've seen that. Signal and Rocky are putting some stuff out. That's great. Because lay people don't know. You don't know. I would have never known. We suggest using council time for plain language briefings from the BHA leadership on safety net system. Share updates with the public through existing state channels. And then we educate council members and members of the public about the behavioral health safety net system and the changes occurring and how they are expected to impact communities and services being provided throughout the state of Colorado. And that we suggest that the safety net system needs to include the underserved populations, such as justice-involved individuals. Significant changes to the safety net system are needed, especially for individuals with serious and persistent mental illness. The current system is not designed to accommodate, appropriately treat these individuals. And the council recommends increased collaboration and communication with the safety net system team to explore ways to improve the system to better serve individuals with SPMI involved in the justice system. I also would say that we need to be better about treating our providers with care and respect that do the safety net work. I've heard some things in the community that we're not being nice to our providers. BHA's got to be kind of providers. They're doing hard and holy work out there. And coming at providers with a punitive mindset is not the way to collaborate with community. So that's the one I'm going to probably be adding to that. I'll send it in. All right, section 3. We're at 14. Dr. Rob, is that the same hand?
Yes, sorry, I'll put it down.
Anything major on the two between the performance monitoring system, the health and the behavioral health safety net system? Okay. Council member recommendations. Additional council member recommendations. Council member recommendations based on their personal and professional experiences. This is where we are allowed and can advise policy based on our lived experiences and the lived experiences of our communities. So we can be as detailed and specific as possible, including information as to why this is important for the larger statewide behavioral health system. So we can add to this additional recommendations. But the key to this will be as detailed and specific as possible and include information as to why this snapshot of your community and how it relates to the bigger health system, right? So we can talk about our small communities. I can tell you what's happening in Palmer Lake, Colorado, but I have to tell you about how that also expands to the wider Colorado network, right? Just something to think about. We can add that, Tasha.
My recommendation with this, out of personal lived experience, and this is through the time that I've been on this council and stuff like that, from living in El Paso County to Larimer County and what Larimer County is modeling and stuff like that, I really think that my recommendation is that the state looks at that and sees how they can implement that, take that model and implement it across the state.
Thanks for that, Tasha.
Because
Michael,
I was just going to say the numbers speak for themselves. So if you guys want to look at the data, the numbers speak for themselves here in Larimer County.
Thank you so much, Tasha. And Michael, I see you in the chat. How do we incorporate services for commercially insured, underinsured people in our communities, and how the BHA can support and not overregulate organizations serving this segment of the population in Colorado? I'd say, how about every segment of the population in Colorado? And I think that's a good question on how we incorporate services, because my biggest concern, especially with the reduction of Medicaid, is the added pressure to the safety net. With the reduction of Medicaid, because safety nets, it will have to say yes. How will that be handled now that people are losing Medicaid at rapid rates? I can tell you they're rapid rates, 10 to 15 a day from our organizations. I mean, really dropping fast on Medicaid, and the safety nets, I'm concerned, will take that on and not be able to handle the overflow.
Hey, if it matters, I just saw that comment being put in, and Natasha was talking about Larimer County. I was a part of, when I worked for the county, developing the MIPS program, which is the pretrial mental health program, the AIM program, which is a probationary program, mental health court, the beginning components of competency court. So if the council ever desires, I can kind of run down through the kinds of things that the different parts of the system that we're doing, at least through my time there. I left there about 3 years ago.
Thanks, Michael. Thank you. I'd be fascinated to hear it. Yeah, I would say the North's got it going on.
Raquel, I am putting in suggestions. I missed the one that you had. If you can go back and add that one.
Is it the one where we care for our providers and safety net?
I think I put that one in there. It was the one right after Tasha talked about Larimer County.
It was probably the care for safety net providers. The other one is how are we caring for the safety net providers who will take on the influx of Medicaid? Because Michael has a good point in there. We have the unincorporated services for commercially insured and underinsured, or now no insurance. That no insurance number is going to skyrocket. And how will that impact the safety nets who will have to take that on? Go ahead, Michael. Talk soon. Thank you for showing up today, sir.
Thank you for your input as well, sir. Thank you.
What about something about being aware of existing stigmas? You see, council member recommendations based on their personal and professional experiences, while being aware of existing stigmas. I don't know. I think that stigma is always one of those battles that we all see and are part of.
Is there something you would add to that? So being aware and doing what with that awareness?
Yeah,
just to add to that recommendation.
I was going to say, it's maybe to add to what he was saying, Preston, if you don't mind, saying something like to the extent of maybe something about increasing awareness of community biases contributing to stigma, and education around dismantling it. Like, for example, like some of the smaller areas don't want needle exchanges. They don't want harm reduction. This is something the BHA can always like improve on, helping educate those smaller communities, helping fund programs out there, stuff like that.
Yeah, I like that. That sounds good.
Mm-hmm.
Or pregnant women not getting services because the hospitals look at them a specific way. I know there's a statewide initiative called Tough as a Mother. To me, it's the most badass thing we have in our state. So it's like anything like that.
You type and go, Megan. You're under pressure too. You're on a whole meeting and stuff. For you. Thanks, Megan. You take good care of us.
You're welcome. And let me know if I'm getting anything wrong. Please call me out if I'm missing something.
Yeah, we have Tough as a Mother, and we got that Lift the Label campaign. There's this big dude from the South Crescent to be on those posters. You got that one too.
Okay, I'll add it.
Raquel,
Cool.
there's a thing from Kari in the chat. I just wanted to point that out so we don't miss it.
No, I thank you. I appreciate that. I know I'm being redundant, but I can emphasize how important it is to make clinicians and providers in general feel respected and supported. Kari, that like literally, I literally got someone the other day who said that, you know, their challenge is that they're not willing to work, but every time that they speak to state that their license, everything's threatened. And we have to stop treating clinical as this, like, clinical is a fear-based, it's really fear-based. Like, if you do not do this perfectly, you will snatch your license. We will snatch your livelihood. That has to be not a way we communicate with our providers. So I agree with you, Kari. I had somebody actually send me a personal message that told me that this is how they experience their experience with the BHA feels punitive, and that is not what we're here to do.
Raquel, just so you, oh, go ahead, sorry.
Yeah, go ahead.
No, just so you know, I did have a meeting with the BHA about this one time and talking about it because, you know, especially even if we know that there's a grievance and we know the grievance is going to go away, it's still, we're asked to take care of other people and help them improve their lives while we're struggling with the process, because also the process takes a long time to flesh out. So you're dealing with anxiety and you're also trying to help people. So I have brought that to the BHA. And Raquel, I remember that was one of the first things you said, and I know we're going to run out of time. Raquel, you said, licensed clinicians are so worried about their license, sometimes they can't help. And so like, I think a lot of clinicians feel that.
Yep. I feel like every moment they're worried about anything. So they don't want to touch anything that might take away their livelihood. And scarcity is not a way to build a system, right? We do not build systems of engagement and participation on scarcity. And the BHA can do better. I know it can. We're actually here to make sure it does. That's actually our role here. So I'm excited. I'm glad we're in agreement with that. I think it's, you know, we got to be kind to our providers. We're already we're already on a very thin line with workforce in our state. All right,
One last thing I'd like to throw in is, as all of the changes take place with Medicaid and people start losing coverage, I think this group is a great group to be able to share experiences that we're seeing in our communities, in our centers. Like, this group right here is a great way to funnel back information back to the BHA to say, this is how we're seeing the impact in our community with these changes, because I think that's important for that information to get back on the state level. We are going to see people off Medicaid, and we're going to see people uninsured. What does that mean to access to care? Are we seeing it, become an issue? What about going to the ED? Are we seeing more people going to our EDs without insurance, or because they're delaying care, that kind of thing? So I think this group, just being able to share our community stories, is super important.
Agreed. And I put that in the chat too, like I think, Jennifer, if you can gather, an example of how that is showing up in your community and how it separates to the broader, I'm going to do the same thing on the peer
Absolutely.
side. I will do an example too, and we'll add it to it. And then we don't have to vote on, we don't have to vote today, do we? We had 2 people drop off, Megan, on quorum, but we can vote. We can do a digital vote on this while we finish up it's not due till September 1.
Yes, we can do a digital vote. My recommendation is to finalize this report today, send it out to council, and if we can digitally vote
Perfect.
Tomorrow. So we'll send out the digital vote form today. And I cannot emphasize enough the importance of making sure you're putting your vote in on that. Tasha, you look like you're not in agreement with the digital vote, so I will.
I was gonna ask, that's why I had my hand up, if we could maybe extend it to maybe Friday, having it finalized Friday so we can send it out so it's before the 29th. Because there might be some extra feedback that that we didn't have time from council members to do that today. So I was wondering that. I know it's not due till the 1st, so if we could extend it out a little bit and then do the digital vote, that'd be great. So everybody's included. It's inclusive.
So we'll send it out tomorrow. We'll make the revisions today and tomorrow, send it out tomorrow, and then ask for council to vote. Hold on, let me pull up a calendar.
Thank you for that. I appreciate that, guys.
We do need to move fairly quickly. Yep. And so I do want to get it to our team prior to the 29th. I would say if council submit their votes by the 26th.
Okay.
It's Tuesday.
And we're going to push you all going to have Tasha and I up in your inboxes. Just be ready. I see you smiling, Preston. I'm going to be all up in your inbox. All right. So we've got to, at the time that I have to open up meeting to public comment. We are now open for public comment. If there is members of the public that would like to speak, please raise your hand and let us know.
We do have one hand up, Raquel, and that's Russia. So I will unmute. I don't know if I could.
Hello, Russia.
Okay, Russia, go ahead.
Hi, good morning. Thanks for giving some space for public comment. I am attending as a member of the public, but also want to be clear that I'm the director of the MindSource Brain Injury Network at the Colorado Department of Human Services. And I just wanted to proffer a couple of suggestions. The first one is that we also at MindSource are really laser focused on providing services to the underserved population. And one of the things that I want to share is that when we refer to people involved in the criminal justice system, we've had similar discussions in the brain injury field. And the way that we refer to that system is the criminal legal system. The legal system itself encompasses everything from adoptions to water court. And so talking about the justice system doesn't seem to actually make people feel like there's justice done, and it is sort of a blind spot. Talking about the legal system is too broad, but the criminal legal system seems to have found quite a sweet spot, and it's used very broadly in the brain injury field. So I wanted to provide that suggestion. The other suggestion that I would like to provide is when talking about underserved populations, socioeconomic status is really important. And when we look across social determinants of health, at least in brain injuries, that is the social determinant of health that ends up having the biggest long-term effect on a person's overall recovery across the lifespan. And you can really tie into census data to look at where there are pockets of people who have lower socioeconomic status. And that can happen in both the metro area. I see Keith is on the council. He can speak to that from his perspective of doing work in Northern Aurora. Maria's on this council. She can speak to that But we also know that there are areas in the state, like in the San Luis Valley, that have lower socioeconomic status. And I didn't hear that brought up, but it does sort of touch on every population everybody discussed when we were talking about underserved populations. So again, thank you for giving time for public comment, and I wanted to offer those 2 points.
Appreciate that, Russia. Thank you, thank you, thank you. Yeah, I agree. I loved the I feel like that's a good compliment to. I was gonna go with justice on majority. I still don't love it though. So I like the criminal legal system. Thank you so much for that, Judge Lee. Alrighty, we are at time. Thank you, counsel. We'll be sending a lot of information. Pay attention to your inboxes. If you have any questions, reach out to Tasha and I. I'm gonna get on a plane and head back to Colorado.
And I just want to add any other recommendations or anything else, please email those to me or Raquel, Megan, as soon as possible so we can get those all implemented into the report. And thank you so much for your feedback today, guys. I greatly appreciate it.
Thank you all for joining us today.
Y'all have a great day.
Wonderful rest of your week.
Goodbye, everyone. Thank you.
Thank you.